Doffing personal protective equipment for Ebola virus disease. This video was filmed outside of the anteroom of an isolation room. Notice how the demonstrator remains within the area immediately outside of the patient's room until all PPE is doffed. This area is indicated in red. Notice too that the observer who is holding the checklist and providing step-by-step instructions remains outside of the anteroom with the door shut. Outer gloves. Grasp the outer edge of the glove near the wrist. Peel the outer glove away from your hand, turning it inside out. Hold in opposite gloved hand. Slide a single gloved finger under the remaining glove. Peel off from the inside, folding gloves inside of each other. Discard in a leak-proof, puncture-proof biohazard pail. Disinfect inner gloves with bleach wipe. Face shield. Grasp ear or head pieces. Lift away from face. Discard in leak-proof, puncture-proof biohazard pail. Disinfect gloves with bleach wipe. Goggles. Grasp headpiece, the elastic at the back of your head. Lift away from face. Discard in leak-proof, puncture-proof biohazard pail. Disinfect gloves with bleach wipe. N95 respirator. Lift bottom elastic overhead first, then lift the top elastic. Lift away from face, holding the elastics. Discard in leak-proof, puncture-proof biohazard pail. Disinfect gloves with bleach wipe. Coveralls. Starting at the bottom of the coveralls, pull front flap to release the adhesive. Unzip coveralls. Pull hood back and roll inside out, touching outside surface only. Remove coveralls, rolling inside out, down towards the feet, keeping gloved hands in sleeves. Step out of coveralls, being careful not to contaminate your shoes. Discard the coveralls in a leak-proof, puncture-proof biohazard pail. Disinfect gloves with bleach wipe. Inner gloves. Grasp outer edge near wrist. Peel away from hand, turning glove inside out. Hold in opposite gloved hand. Slide single finger under remaining glove. Peel off from the inside, folding gloves inside each other. Discard in leak-proof, puncture-proof biohazard pail. Perform hand hygiene with alcohol-based hand rub or soap and water. Doffing personal protective equipment is a skill that must be practiced multiple times before you will feel comfortable with the process. Do not try to memorize each step. Remember that you will have an observer with you who will call out each step of the donning and doffing process. While you practice, focus on habits that may lead to contamination and teach yourself to avoid them. Common issues observed during training include placing chin near chest, touching face, and balance issues.